So how exactly do we describe the community that we're focusing on? Well, we can break that up into three different categories, which are person, place, and function. So for person, we can define that as the houseless population of Portland, Oregon. That includes all ages and genders, and also any and all sexual orientations, religious and spiritual beliefs, races, ethnicities, and cultures. As for place, that includes the city of Portland, which is the north, northeast, northwest, southeast, and southwest cities boundaries. It focuses on the inner city, but it extends to the surrounding suburb areas. This also includes homeless shelters and camps and individual campsites as well. As for function, safety is huge for the houseless population because not having a functional permanent home can put a person at risk for numerous physical health complications, mental health problems, and violence. The support system slash sense of community is also huge because houseless people have the same needs and desires for social interaction as others do. The support they receive from people in similar situations is beneficial mentally and emotionally. And resources. Many shelters do provide resources for homeless people, and food is an example of one of those.
Start off the existing and readily available data. Um, Made a couple charts looking at the gender, age, and racial distribution. The majority of our population are Caucasian, with the second biggest percentage being African American. For age, almost everyone, so it looks around 80%, are between the ages of 25 and 69. And then looking at gender, there are almost twice as many males as female, with a very low percentage being transgender or non-gender conforming. This slide looks at the socioeconomic and housing data of the Portland houseless population. This population sits at the bottom of the socioeconomic ladder. They have no income, no savings, and likely no money on hand. Most have a lower level of education compared to the rest of the population. If we look at the chart on the right, we can see that over half of the population is unsheltered, meaning they're living in parks, under trees, in tents on the side of highways, and in places where we are not meant to live. 36% of the population does have shelter in the form of emergency shelter, and then another just about 13% are in transitional housing, which they can only stay in for a limited amount of time. Looking at vital statistics in the existing and readily available data, disabilities are extremely common in Portland's houseless population. There are many different disabilities present, but a couple of the more common ones are mental illnesses and substance abuse disabilities. If you look on the chart, you can see that 72% of the population has more than one disability. And then the most common disabilities are mental illness, substance abuse, being alcohol and or drug abuse. For community institutions and healthcare for the Portland's houseless population, the main institution available to them is shelters. Shelters are spread all throughout the city. There are a couple different types. There are these outdoor village type shelters where everyone gets about this a room about the space of a shed. So they have their own personal space and belongings, but it's built in a group, so they still have a sense of community. And then there's other shelters that are classic, built inside of a building with a bunch of cots available. And then for healthcare, there are a lot of free clinics throughout Portland, especially some that specifically serve the houseless population. And there are also hygiene stations which provide free hand washing and free bathrooms for anyone who wants to use them. Already reported data. Source 1, Portland Street Medicine. Portland Street Medicine is a community organization made up of volunteers that have witnessed the suffering that Portland's houseless population have undergone and decided to make a difference. They specifically address the healthcare needs of the unsheltered. They provide medicine, information, assessments, and other medical supplies to Portland's unsheltered houseless population, in which 72% report a chronic disabling condition. The mission of Portland Street Medicine is to make a difference in the population that has been hidden and forgotten by the city of Portland. Homelessness in 2021 is an annual series completed by a team through analyzing data gathered from the U.S. Department of Housing and Urban Development's 2020 point-in-time homelessness count and the U.S. Census Bureau to determine the overall picture of homelessness in different states and cities in the United States. With this data, they have determined that the percentage of the houseless population that is considered unsheltered has risen consistently over the last 5 years. Although shelters are available in most counties throughout the U.S., it has been estimated that about 226,000 people sleep on the streets, in vehicles, and other places that aren't meant for people to sleep in. With the boundaries dividing Portland, we found that there are racial, political, and financial boundaries that divide the city, and these three maps kind of show different elements of that. Look at housing and zoning in Portland. There's a range of single-family and multifamily homes throughout Portland. Northeast Portland is considered the most damaged and in need of repair area in the city. Transportation-wise, there are the TriMet bus system, Max Light Rail, commuter rail system, aerial tram. The condition of all these is well maintained and well lit. The neighborhood streets, however, are less safe comparatively, and also do not have nearly as much lighting. Signs of decay. The area is pretty dirty. We saw a lot of trash and some cars that had clearly been sitting there for a long time. No wildlife, and there were a lot of tents, especially in vacant lots. A lot of the tents were in decent shape, but the rain that Portland gets significantly damages them over time, and they had clearly been taking a beating. For race and ethnicity, the predominant ethnic group is Caucasian. Minimal ethnic groups were represented. The only language identified was English. People in the community, you get a sense of social class based on the clothing and general appearance and mode of transportation of the people walking around. Hipster fashion is trendy, especially in Portland itself. The open or common space, people usually gather in bars and restaurants and benches around town. The city is not as busy as it was before COVID and the protest. There are some no camping signs posted around the city that mainly pertain to homeless people trying to set up and sleep in certain public spaces. Service centers. The primary hospital systems are grouped on the Southwest Hill. There are 79 total schools in Portland. For communication, newspapers covering the ground homeless people were using to read or use for insulation. Multiple youth PDX billboards were spotted throughout the city. Parks and recreation. Several recreational parks around the city that encourage outdoor activities. Homeless campsites located near the parks and around them. More visible, unsheltered population, which is partially related to the affordable housing crisis. Religion. Churches in Portland are rare. 42% of Portland is atheist. Stores, mostly chain stores and small businesses spaced throughout the city. Health and morbidity. Weathered faces and skin, very skinny, and other physical signs of drug use. We found needles on the edges of sidewalks. A lot of people were seen coughing or wiping their nose multiple times, indicating they had a cold or illness of some sort. People were walking and talking loudly to themselves, most of which was incomprehensible. Protective services. We saw 3 fire stations in downtown Portland, 1 main police bureau in downtown Portland, 1 near OHSU, and another in Multnomah County. Greater police presence in lower income areas. Industries. The major industries of Portland include tech, manufacturing, athletic outdoor apparel, and healthcare. Both Adidas and Nike have their headquarters in Portland, as well as other outdoor brands such as Columbia and Prana. For politics, signs and flags were spotted throughout the cities in store windows and on residencies. Examples, LGBTQ pride and BLM flags. Predominant political party is Democratic.
Tasha, what are the most common circumstances that led to shelter guest homelessness? She says, housing is too expensive and jobs don't pay enough. The housing market has intentionally discriminated minority groups. Things like redlining, discriminatory lending practices, and displacement through gentrification have created generations of poor people. She also mentioned that in Portland, we don't have enough homes for every person who needs a place to live, and it's because new people are moving here faster than we can build homes. And obviously, when supply is low and demand is high, the price goes up. So it's really hard for people to be able to afford it. Is there an interest motivation for those on the street to get off? She says, of course there is. People who come into our shelter desire a better quality of life, but don't know how to access it. We see families who are about to get evicted come in looking for financial assistance. We welcome homeless families seeking a house, or maybe they're seeking shelter assistance. What do you, as a shelter worker, identify as gaps in public services? Lack of affordable health care, such as large copays, expensive prescriptions. There is also a lack of affordable childcare. The average cost of childcare for one child in Portland is $1,020 a month. And then I added that it's kind of a loophole. So parents need childcare to get a job and to even land a job interview, but they need income from a job to be able to afford childcare. So they're kind of stuck. Does our cultural attitude have anything to do with the explosion of homelessness? The lack of reliable relationships creates isolation and insecurity, and I think our culture's attitude towards homelessness is viewing them as a menace. Society needs to change their perception of homelessness. They are people just like us who have fallen into far more unfortunate circumstances, which I agree. Are there any experiences or encounters you've witnessed as a shelter worker that changed the way you view homelessness or shelter assistance? There was a homeless woman we were looking after in Portland. A friend graciously took her off the streets and welcomed her into her home. But the woman didn't enjoy living in the house. In fact, she preferred to be homeless. It wasn't long until she went back into her tent. We run into this dilemma a lot. That is why it's important to make sure the shelter guests have the same goals in mind. Our second Key Informed interview will be with Vaughn Longenecker. The same exact questions as the last interview. I said, what are the most common circumstances that led to individual homelessness? He says, high cost of living, jobs not paying enough, and mental illnesses. Is there an interest motivation for those in the street to get off? He says, most of those I encounter actually want to be on the street. Some may say they want off the street, but their attitudes and actions don't match. That is, they want to do drugs and alcohol. They like hanging with their buddies in the street culture. They are not working on getting off the street. That is, they aren't going to every agency, trying every avenue for work, trying to improve their situation in any way and on. So this perspective is a lot different than what we heard from Tasha, and I appreciate how honest Vaughn is, because I know there's a lot of truth to what he's saying. What do you personally identify as gaps in public services? Of course, there are a lack of social services, but mainly the church has a responsibility to help them. Just like we have a responsibility to help those same people in the penthouses, and he's referring to like the rich, who are just like on those on the street, sinners in need of a savior. So he believes that the church should take full responsibility and kind of step up in their serving. And then, of course, he points the solution back to the Savior. And I thought that was a nice touch that he added. Does our cultural attitude have anything to do with the explosion of homelessness? He says, our pop culture has glorified drugs and alcohol for quite some time now, which has played a huge role in what caused so many individuals to fall into substance abuse and addiction.
The first literature review was on an article titled Curing Homelessness in Seattle, and this examines the amount of money that is spent trying to combat homelessness, the causes of homelessness, and some services to aid the homeless population. This article is relevant to our study because it focuses on the same population, which are houseless people, but in a different setting, Seattle instead of Portland. So this article broke down 4 separate main ideas, and the first one is financials. Quote, Seattle's homelessness response program spent $68 million in 2017 on the crisis, $78 million in 2018, and increased spending to $116 million in 2020. These funds went to a combo of outreach services, sanitary cleanup, and in 2020 to affordable housing. Another thing this article focused on are the causes of homelessness. According to this article, income inequality, mental disorders, substance use, lack of affordable housing, domestic violence, and those who lack social support systems. Some services that this article talked about to help homeless people are alternatives that are compassionate and goal-oriented, which include protecting victims of domestic violence, providing mental health services, and offering low-cost housing to those in need. Another article we looked at is titled Research Weekly, Homelessness Increases Among Individuals with Serious Mental Illness. And this article looks at the impact that mental disorders have on the overall houseless population. This is relevant to our study because it focuses on houseless people in the overall US, but specifically those who have at least one or more diagnosed mental disorder. So, how many houseless people suffer from at least one mental disorder? Well, a conservative 2017 estimate says about 25% of the houseless population has a serious mental illness. In addition to that, the prevalence of serious mental illness among unsheltered individuals is much higher than in the general houseless population. This article also looked at chronic houselessness and how that affects people. According to this article, those who experience chronic houselessness are 33 to 55% more likely to also have a serious mental disorder. And chronic houselessness is defined as someone who has been homeless for at least 1 year or more. Some interventions and services this article advocated for include promoting assisted outpatient treatments, restoring psychiatric hospital beds, and improving civil commitment laws and standards.
So now that we have gathered all our data, we're looking to analyze it and find one problem that we can address. So we've looked at the population and we can see strengths, we can see weaknesses, but one glaring problem was health illiteracy. And this could be due to low education level, knowledge deficit, or as we can see from the stats, chronic mental illness. So we also have listed the Healthy People 2030 objectives that relate to health literacy, and we can hope to address these. So our official problem statement is this population is at an increased risk for adverse health outcomes related in large part to inadequate health literacy. This reflects a deficit not only in one's ability to moderate their own health, but also distinguish available resources within their community. This breeds a multitude of health complications, including cancer, men's and women's health, podiatry complications, ill-managed chronic diseases, and so on. Addressing this problem ties in with Healthy People 2030's objective of health literacy. So the two goals that we have, short and long, seek to address that problem. The short term, we're actually hoping to be more of a comprehension base. They understand their resources, they understand their health. And long term, we hope to see them actually use these resources more reliably across a longer period of time. One of the ways we hope to reach these goals is actually by training homelessness service workers on how to establish a legacy of health literacy among the homeless population. So this could be social workers, it could be volunteers, community coordinators. And so the nurse's role in this would actually be to collaborate with these members and try to provide that continuity of care. It would also be good to evaluate current and trending health knowledge, because this would directly correlate with our short-term goal. And the second intervention we have listed is to address the long-term goal, which was seeing that the homelessness population, the members of this population, are actually utilizing these resources and improving health outcomes. And one of the ways, the simplest ways to achieve this is simply by spreading the word.
So before we get into evaluating our outcomes, we need to talk about how to properly implement interventions in order for interventions to be successful. So why don't social services always work? It's because social service systems have neglected to center on the strengths of the houseless individuals. Common factors theory states that 85% of factors for successful treatment come from the client's own experience, their hope for change, and the relationship with their provider. So we should be focusing and enforcing Multnomah County's assertive engagement. Multnomah County has its own evidence-based practice, and it focuses on participant-centered, strength-based, culturally specific initiatives. And what we've seen in that has had the most success is applying this assertive engagement, and so it's the solution. So so there's the strength-based approach, motivational interviewing, assertive community treatment, which is everything we've already known about. So now we're going to evaluate our outcomes based on proper interventions. So in that little box, I set up a list of how shelter programs usually track their progress. And that's individual service plan goals, shelter surveys, life skill surveys, and client interviews. And as a recap of interventions based on our project goals and our problem statement, we have train service workers and share active and available resources to individuals in need. And so the statistics that I'm taking this from is from the Portland Homeless Family Solutions, which is actually the organization that we heard from the first interview, Tasha Danner. And so this is their most recent statistics report in June 2021. And the administration actually applied the evidence-based practice I was telling you about earlier, the Multnomah County's Assertive Engagement Initiative. And it turned out really, really well for them. And they were talking about it on their, this is from their pamphlet. It's like their annual review. And they were talking about the evidence-based practice and how successful it had turned out for them.